ECT and its role in mental health. ECT is a treatment option for patients suffering from depression and/or suicidal tendencies. Patients who have tried alternate mainstream treatments such as personal or group therapies, as well as antidepressants without relief of symptoms, may find ECT as a viable option. So what is ECT? ECT stands for electroconvulsive therapy. Essentially, it is a purposefully induced grand mal seizure. Electrodes are attached to your head, and there are usually about 2 medications given before treatment. A short-acting anesthetic such as amidate and emectine to prevent muscle contractions during the seizure. 2 probes are placed on top of the electrodes. A foam piece is placed in your mouth to keep your tongue from closing off your airway. Once the medications are administered, a current of electricity is sent through your brain, this causing the seizure. Each seizure lasts a different amount of time. A series of treatments is normal. Then, as time passes, if the patient feels the symptoms are returning, they can come back in for a tune-up treatment. Again, for each person, the number of treatments and how long between additional treatment will vary. Over the years, ECT has gotten somewhat of a bad name. From the early uses to its projection in movies, it's hard to get some of those images out of your head. But the reality is, a relatively safe treatment alternative for those otherwise who have lost all hope of relief. The most severe side effect would be death. However, the statistics show about only 2 in 100,000 being treated might have that effect, usually contribute to a cardiovascular complications. And a thorough cardiovascular evaluation should be conducted prior to the treatment. The most common side effect is short-term memory loss, usually just for a few hours and mostly just regarding events leading up to the procedure. There are some patients who say they have gaps in personal memories. That, however, seems to be linked to the number of treatments they have received. As of now, there is no evidence to substantiate that the electroconvulsive therapy produces any permanent changes in brain structure or function. For more information on this subject, visit www.mayoclinic.org. For more information about mental health, you can go to www.nih.nih.gov. That's the National Institute of Mental Health. I hope this information provided today was able to answer a few questions you had possibly had on this subject. This was brought to you by Jennie Hoagland. Thanks.